So what I'll do is, before we get started, I'll do a quick introduction. So we've still got people jumping in. So my name's Andy. I'm the founder and director of a company called We Are Wellbeing. So we are one of your wellbeing partners, and we're going to be supporting you in lots of different ways. We started off with these cohorts of wellbeing champions. But as an organization, what we do is we specialize in two key areas. One of those areas is education around well-being. So everything to do with physical health and social well-being and mental health as well. And then the other side of what we do is screening. So my background from a health perspective, just so you know, you've got somebody in front of you that's talking with some experience, is I started out in the health and fitness industry. And when I graduated from university, I went to work for Bupa, and I worked for Nuffield as a physiologist. So what happened there was people would come in to see me as a health advisor. I would run all these weird and wonderful tests to see how people fared from their health. And then they would go see a doctor. They'd get some of the more invasive tests from the doctor, and they'd come back and see me, and I'd give them lifestyle recommendations based on what we've identified. So quite a useful process. And what that gave me was a really good insight into health screening and a lot of the sort of the health concerns that some of us guys have, but also had to put myself out there to make sure that, that I understood what we were talking about. Now, I'm 36 years young, so I've not necessarily been in a position where I need to go for some of these screens, but I've had them anyway, just out of sort of health curiosity, but also certain things that have happened along the way. And I'll disclose some of that. So I'm just going to share my screen and get myself set up. So can I get a thumbs up once you can see my second screen there? Perfect. And can everybody hear me all right? That's a great start. That's a great start. Okay. So in today's session, then, we're going to be looking at some of the following. So we're going to be looking at some of the men's health stats. So, why are we even having this conversation? Why are we talking to you about it? What are some of the important things that we need to know about? We're going to look at ischemic heart disease or something what referred to as cardiovascular disease as well. We're going to look at specifically some of the male cancers. So this is some stuff that we need to be aware about. I want to do a little piece around screening, about health screening and health assessments. Generally, this is something that us blokes are typically not very good at. We might get dragged to the doctors when we feel that we're really, really ill. But just general awareness and screening isn't something that a lot of us kind of put ourselves out for. Now, just to kind of put it out there, obviously I've seen a lot of this from my health screening background, but what has happened in the past few years, I've lost colleagues to prostate cancer in particular. I've lost colleagues to prostate cancer, and I've lost colleagues to suicide. So for me, from a personal perspective, this is something that I won't say I love talking about, but I'm very passionate about talking about, because I don't want to, if having a conversation like this with you guys persuades one of you, gives you a bit of a kick up the butt to go and get a check, then it's a job well done. So that's part of the motivation of why I like talking about these sessions. We want to take a look at some managing the risk. Really, everything that we do as an organization at We Are Wellbeing, it's about looking at your manageable health, the stuff that you've got some control over. And we've got to face the facts that we're all accountable. There's loads of other outside factors that have an impact on our health and well-being. But if you're not taking accountability for your own health and well-being, if you're not managing your manageable health, eventually it becomes unmanageable. So, we've got to take a little bit of accountability for ourselves. And part of that is having some self-awareness. So first point of actually being here and listening to me talk is a great start. And then we'll do a bit of a summary. I'm a very, very relaxed trainer. If anybody's got any questions, throw them in the chat, unmute yourself. Feel free to interrupt me. It's absolutely fine. And I'll if I know the answer, I'll try and give you some feedback. Okay. So just some of the stats then, just to start off to see, where the land lies and what we need to be talking about. So we know that 19% of all male deaths are under 65. Now I find that quite alarming. That is way more than I thought. When I think about 65, especially as we get older, 65 is very, very young. So for 19% of us not to be making it that far is a tragedy. And a lot of that can be accounted for by not looking after our manageable health, is deaths that are completely avoidable. So that's one part of this. Then we look at ischemic heart disease, is the leading cause of death in men. So if we're not looking after our heart health, so let's do this. Let's do a thumbs up. I think you can do a thumbs up through the without actually having to have your camera on. How many of you know your blood pressure? Okay, not many. How many of you know your cholesterol? Okay, there's two things there. There are two actions that you need to be following up on from this session. So these are some of the baseline things that we need to be aware of, and we're not even started yet. We look at obesity. So 26% of UK adult males are classified as obese, and that's not just overweight, that's obese. So clinical obesity. So that's a BMI, a body mass index of over 30. So a body mass index is what we call our weight to height ratio. There's a lot of people in the fitness industry that don't like body mass index as a measurement. Any ideas why?
It doesn't account for your size, as in general kind of physique. So I'm around 15.5 stone, 5'9". I wouldn't say I'm overweight. I'm probably a little bit overweight, but I wouldn't say I'm obese. And I'm quite a big build, broad shoulders. So it doesn't account for every physical aspect. Yeah.
Yeah. So it doesn't, you know, if we went and measured, I don't know, it was down the road. I live in Leeds, so the Leeds Rhinos, every single one of the Leeds Rhinos would be overweight or obese. So it does misclassify people. But what we've got to remember as a national health measuring metric, we don't have a bodybuilding epidemic. Most people who have a high body mass index are overweight because there's too much body fat. Yeah. So actually, when we look at public health nationally, it's a reasonable measure, because actually most people who are overweight have too much body fat. So that's one thing to consider. We then look at lung cancer. So lung cancer is the leading related cancer in men still. So when we think about prostate cancer and testicular cancer, lung cancer is still the leading cause of cancer deaths for men in the UK. Prostate cancer is the second most common. Suicide is the leading cause of death in men 35 to 49. When we get to this point here, I always ask the question, and we'll kind of put this out to anybody who wants to chip in, but why do we think it is the leading cause of death in that particular age range? What is it about? Because I'm 36. What is it about being between 35 and 49 that increases that risk so much? Any thoughts?
Is it to do with the stigma around mental health? And as you get to an older age, maybe people feel like they have more of like a obligation to be like a man.
Maybe. Yeah, potentially. You know, I think when we talk about the stigma of mental health, you know, I'm sure we can all agree that we're talking much more about mental ill health in society more than we used to do. That, you know, you can't move for the conversation of mental health. So the stigma is improving, but we are nowhere near where we need it to be. We need to be talking about it more. We need to be having more open and honest conversations. We need to remove that whole man up culture, and I think in younger generations, that's starting to improve. We're seeing more young guys feeling more open and honest about talking about their mental health. So that's great. And maybe this will shift as those younger generations become the older generations. Hopefully that will start to improve somewhat. But there's something about that age range that particularly puts them at a higher risk. Some of the things that sometimes come up, it could be midlife crisis, potentially not being exactly where you thought you'd be at a certain point in your life. Like I said, I've just hit 36. I've had my midlife crisis. I've just started skateboarding at 35, at 36. I look absolutely ridiculous on a skateboard, but I love it. And it was cheaper than a sports car. So, you know, each to their own. I'm sure everyone else has got something that they've gone through. And then when we look at 3/4 of all suicides are men. So, you know, when we compare ourselves to the other sex, much higher risk of suicide than women. So there's something to be said for the male mindset and the social pressures that we find ourselves under, because it's contributing to a large number of blokes taking their own lives. I personally have got 2 friends, or I've got 3 friends who have all died by suicide. 2 of them guys, both under the age of 42, both had jobs, both had family, both had purpose in life, both were the life and soul of the party, and both of them not here anymore. And it's what's really difficult about it is I didn't spot any signs or symptoms. And I probably didn't spot any of those signs and symptoms because of the stigma of mental ill health. I'm just seeing someone's put the sound quality is not very good. Can everybody else hear me okay?
Yep.
Right, okay. It might just be my Yorkshire accent. I might need an interpreter. I don't know.
Most of us are Northerners anyway, so you're all right.
This is it. I was in Manchester yesterday. I couldn't understand a word. Right. Okay. I've got, so we'll talk about mortality and I suppose age-related deaths. I think it's important to take a look at what are we at a higher risk of at certain stages within our lives, because it's going to be different for all of us guys. So we've put this together to look at this. So first, the primary cause of death for each age range. So we've got between 10 to 19, between 10 to 49, the leading cause of death is suicide and injury. Between 50 and 79, it's heart disease. And then 80 plus, dementia and Alzheimer's. So when we're thinking about our personal health, if we took a look at suicide and injury and heart disease, that is largely avoidable. We can massively reduce the risk factors of early or premature death as a result of either of those two by developing more self-awareness and having better conversations. 2 really simple things that we could be doing to help manage our own health. The second most common cause of death in these age ranges, so under 19, was transport accidents, accidental poisoning, 20 to 34. So generally that could be alcohol or drug use. We've then got heart disease in 35 to 49. Now, if we think about going for a heart check as a guy, any thoughts on what age you should start going for a heart check?
$50.
40.
Yeah, it could be. There's some tests you could do plus 40. There are some tests, more invasive tests, plus 50. But if we're looking at 35 to 49-year-olds, the second leading cause of death is heart disease. And that's actually getting younger. Why do you think heart disease, and it's the same with diabetes, why do you think those kind of health concerns are happening in younger people?
As the obesity kicks in, the obesity epidemic is fueling that more stress on the heart.
Yeah, absolutely. So as a prime example, when we talk about diabetes as a subject, type 1 diabetes is this, what they used to call, it's like an autoimmune response, but then type 2 diabetes, or the lifestyle diabetes, what we sometimes refer to it as, years ago, they used to call it adult onset diabetes. And they don't call it adult onset diabetes now because more young people are developing it as a result of poor diet and poor lifestyle factors, physical inactivity and poor nutrition, and a relationship with convenience food. So these are definitely things that we have some impact on. Obviously, we've got lung cancer there between 50 and 64. So the most prevalent cause of cancer death in men in the UK, that is starting to lower. I'm coughing my way through because I'm still ill, not that I'm a smoker. Just let somebody in. And we're starting to see this reduce as well. So, you know, thankfully, those numbers are starting to reduce on cancer deaths. And then we've got heart disease as a secondary cause of death in 80s plus. Third main cause of death in certain timelines is murder or homicide under 19s, transport accidents 20 to 34, accidental poisoning, so 35 to 49, so that'll be alcohol and drugs. Liver disease, so that might be high levels of alcohol. So looking at things like liver function testing there, respiratory diseases, and then influenza and pneumonia over 80s. Is that, if I hadn't have shown you this, is that what you would have expected for each of the age ranges? Are there any surprises there?
I think suicide and injury for 10 to 19-year-olds is massive. Yeah. Like, I would never have guessed that in such young people.
Or homicide.
Yeah.
And when we look at that, you know, and this is where you talk about like the conversation, you know, like the conversation when I was at school is what's the ideal time to start having sex education? One of the big subjects now is when's the ideal time to start talking to kids about mental health and suicide? Because we know it happens. It's happening far too frequently. So it's, like I said before, we are doing a lot of good work in society, in organizations around mental health, but we're nowhere near where we should be. We still need to be having more. Really, what we need to be doing is normalizing this conversation. It should be just as easy for me to talk about my mental health as it is to talk about my bad back. They need to be one and the same. That's where we need to get to. And that's only going to happen by us sharing more stories and talking and having more safe spaces to talk about it. Okay. Any questions before I move on?
I've had a few people that I've known over the years who have taken their own life, and the main reason for that was having issues with like ex-partners with children, and them stopping them from seeing the children, which has a massive effect on men's health. It just seems that, I'm not saying all cases, but you do find we kind of like second in line to get any type of rights no matter what. And that is one thing I've definitely noticed over the years, that does have a huge impact on suicide.
I 100% agree. So one of my old bosses, Pete, he was in the same, that's exactly the same reason why he died by suicide. Couldn't see his kids on his terms, and it just too much for him.
Yep.
So I think the difficulty is we handle things, you know, we don't handle things well. Quite often when it comes to mental ill health, we've all got coping strategies. Some of us have positive ways of coping. Some of us naturally adopt more negative ways of coping. And I think if one of the things that we always try and do as an organization is try to help people to develop a little bit of self-awareness, because the issue is a lot of people who are struggling don't realize that they're struggling. And when you can have, as an organization, you can have EAPs, you can have support lines, you can have wellbeing champions or mental health first aid, you can have all these amazing resources. But if somebody doesn't realize that they're struggling, they won't reach out. So one of the best things you can do is sitting down and having conversations with people.
Yeah, I agree. I also believe that, like one of my friends, he went round the whole situation the correct way, solicitors and all the rest of it. The problem that he had was just the law itself, kind of seeing him as, you know, second nature, and the mother was more important, what she said goes, and so on. So even when he was going down the right routes, he was coming up against problems where their solicitors and so on was giving them all the rights, and he was just not winning at all, proving that he's a good dad, all the rest of it. And unfortunately, it just got to a point where he knew that he's never going to win. He could have had the best lawyers ever, and it was still a situation where she's just going to make things awkward, and he couldn't see his children. And unfortunately, these things also need to change massively, because you do see it's like, I don't know if any of you have noticed over many years, decades, where you get men dressing up as superheroes, climbing buildings, and
Fathers for Justice, is it?
Yeah, trying to make some sort of trying to get these things looked at. But yeah, That's what I've noticed. And also 10 to 19 homicide, depending on what area you live in and where you're from, you probably notice that there's a lot more different crimes. The area that I grew up in, I've had a few friends who have been murdered. Some of them, I don't know why, but they've ended up in a crossfire between shootings and ended up dead. And at the age of like 18, 19, some 17 years old. Some really nice people as well, you know, not into these type of gangs, unfortunately. That is a big factor as well, especially in certain areas.
And I think one of the things that we've got to do, and I think it's almost a bit, I suppose, a bit of there's a campaign to do around it, is it's about people being curious. It's about people finding out more. And, you know, you guys coming on sessions like this, but like for us, it's making sure that we're not just living in our little bubbles and paying attention to the stuff that happens in our own personal lives and asking, why is it the case that suicide is so prevalent in young people? Why is it that homicide is so prevalent in certain areas? And it's a learning journey, but I think you're definitely right. There are certain things that needs to change. Obviously, out of our hands on a 60-minute webinar to talk about, but there is additional things there for us to consider.
Yeah, I also sorry to go.
No, you're all right. You go for it.
I also believe that a lot of companies as well seem to just sort of like bring this type of thing up when it's that time of the year.
Yeah. Oh, a big. Don't get me wrong. My biggest bugbear is organisations that do a wellbeing week once a year.
It's ridiculous.
But what the difference is,
it's good, don't get me wrong, but
well,
for the rest of the year, for the 11 months, it's kind of forgotten about, because I know companies probably see people struggling in a situation.
Well, what we want to do is
get on with your job.
The approach that we, as a wellbeing partner, what we're here to do is to make sure that we don't just have this transactional relationship where we do a course, we leave you to it, and then we say see you later until the next payday. What we want to do is make sure that we give you access to the resources and the other things that you need. And if there's something that as a team that you feel that you need more information on, whether it's a specific subject or something that we can support you with, let us know. Because what we can do is we can go and create it, but then what we can also then do is share it with our wider network of other organizations that we work with. So we're constantly building this pack of resources, this digital toolbox of resources that can benefit everybody. But it only grows if people are asking us for additional things. So if there's something that you think that would benefit you, let us know, and we can use it, our team of experts, to develop that.
Yeah. Another thing as well, Andy, I also think that within certain organizations, you do find certain departments are maybe one-sexed kind of thing. So sometimes you find a HR department maybe just one sex, or, you know, certain departments, and then it's like a woman may find it difficult to bring up certain things with their mental health that maybe they need other women to kind of understand as well, and men might not quite get it. As it's like the thing with the menopause. That's a big thing at the moment, and treading carefully and dealing with people who are maybe going through the menopause. A lot of men may not understand that, or probably see it as you've probably heard yourself, a joke where, oh, she's probably going through the menopause. Now, that's not really dealing with it. All you're doing there is actually just laughing at the situation. And I think with men's mental health, I also believe that sometimes if you look at, say, let's just say a HR department that is predominantly one sex, they may find it kind of difficult for that understanding of what they may be going through, which could be a man's type issue.
Complete. And this is why we always encourage. I'd always encourage, you know, anybody to jump on these sessions. So it's great to see a couple of women on these sessions. Yeah, you know, I think if we're doing sessions in future on breast cancer awareness or gynecological health. I attended a session on gynecological health last year. One of the best webinars that I've been on. You know, I'm never going to go for a smear test myself, but I've got a wife, I've got a mum, a mother-in-law, I've got 2 little girls. It's just as important for me to understand that stuff as anybody else. So, and then this is this whole thing about being curious. We've got to make sure that we're open to ideas.
Yeah, the thing is as well, the woman might only have their partner to talk to, and the partner's not understanding. So if they go on these type of courses to make it easier for, you know, that conversation to happen between both sexes
100%.
as well.
100%.
So yeah, I think everyone needs to understand all aspects of, from different
Well,
sexes to different, you know.
when we've got webinars on, promote them, drag people to them, tell them that we're here.
Yeah.
Okay. So I'm just conscious of the time. I just want to make sure that we cover everything. So this next part, we're going to start looking at heart disease. So when we start looking at heart disease, it occurs of what we call the process of atherosclerosis. So what you can see here on the right are 3 different arteries at different stages. So first of all, you've got arteries and veins. So arteries, the job of an artery is to take blood away from the heart. Veins take blood back. And what you've got here, the top one, is a really nice, clear, healthy artery with good blood flow, and the walls are nice and flexy. So what happens when somebody, for example, when somebody smokes, that can harden and narrow and roughen the walls of the arteries. When someone's got a diet that's high in saturated fat, so if somebody's got a high LDL cholesterol, so this is why it's important for us to know our cholesterol score. So when it comes to cholesterol, you've got total cholesterol, and your total cholesterol is made up of your HDL. So HDL stands for high density lipoproteins, and they're what we call the good fats. The LDL are low density lipoproteins. And the best way to think about lipoproteins are that they are the carriers of fat through the bloodstream. So when we think about HDL, a high density lipoprotein is like a really good quality rubber dinghy that's taking the fat through the bloodstream and depositing it where it needs to go. The low density lipoprotein is a bargain basement £5 dinghy that's going to deposit the fat here, there, and everywhere. And when the LDL deposits the fat in the artery, it can stick and line the walls of arteries. And then over time, over years and years and years, that fat will stick and build and build and build and build over time. So it doesn't happen. If you have a cheeseburger for lunch, you're not going to suddenly increase your risk factor of heart disease. It's going to take years and years to build up. And what happens is this starts to line and stick. And eventually you create something called a lesion. And you can see in the bottom artery, you see there's this hard lump of waxy fat that's collecting blood vessels. So what would happen here is that hard lump of waxy fat would start to become brittle. And then if for some reason the blood pressure becomes higher, either somebody goes for a run or somebody becomes stressed, somebody goes for a game of squash, and they get a sudden rise in blood pressure, that blood pressure can push against the artery, push against the arterial walls and push against that lesion and break that hard lump of waxy fat off. And then the problem is you've got this there's a lump of hard waxy fat floating through your bloodstream, and that could then get stuck in one of the narrower arteries. So the narrower arteries, like the coronary artery that supplies blood to the heart, or the cerebral artery that supplies blood to the brain, if they get blocked, that would lead to a coronary, would lead to a heart attack, a block of oxygenated blood to the heart, or a cerebral artery would be a block of oxygenated blood to the brain, and that would be a stroke. So cardiovascular disease accounts for about 1/4 of all deaths in the UK. So when I'm asking you the question, do you know your cholesterol and do you know your blood pressure? They are 2 things that want to be on your radar. Now, most of us will not get one of those health checks until, I don't know, maybe 40, 45. There's not a lot of 20 or 30-year-olds I know that go for health checks. But the problem is, if we're finding out in our 30s and our 40s, or in our 40s or 50s, sorry, a lot of the damage can be done. Whereas if we identify early that we've got a tendency for high cholesterol, then we can start to do something about it earlier on. So we don't become dependent on medication. Everybody happy with that? And like I said, there's different types of cholesterol tests. You can get a simple finger prick blood pressure cholesterol check to do your total cholesterol. You can get a slightly more in-depth one that will give you a finger prick and give you your total HDL, LDL, something called triglycerides, which is another type of fat, and then the ratios between all of them. So the ratios on your cholesterol are really important, because somebody could have a really high total cholesterol, But if the good and the good and the bad, or the HDL and the LDL, are equally balanced, then the ratio is fine. So it's not just about have you got a high total or not. Or equally, you could go for an intravenous, a blood sample from the arm that gets sent off to a lab, and that will give you a full lipid profile. If anybody's worried about their cholesterol, you can actually go to your GP and ask for that, a full lipid profile. And that will give you a really good overview of your cholesterol. It's just worth mentioning before we move on is that LDL cholesterol is naturally produced in the liver. So most of your what we call bad cholesterol is produced in the liver. So you can actually have a high level of bad cholesterol even if you've got a really healthy diet. So some people who have high cholesterol, they can have the healthiest diets in the world, could be on a Mediterranean diet, but still need medication. So it's not just about your diet. Okay. So this is the process of atherosclerosis. And there are no formal or external signs or symptoms. The first sign of a heart attack, or first sign of high cholesterol and high blood pressure, can be a heart attack. So this is why it's really important for you to have some sort of baseline screening to start with. So that's heart disease. Obviously, we talked about lung cancer, still prevalent in men over sort of 55 to 70, but some of the risk factors then, obviously smoking still causes 70%. The other 30% quite often can be pollution, so in work-related pollution or environmental pollution or secondary smoking. Things that we want to be looking out for, things like long-standing coughs, regular chest infections, so if it's reoccurring, any coughing up blood, regular chest pain while breathing on either side, on left or right side. Often we focus on left chest pain for heart disease, but it could be on either side. Fatigue, so not constantly feeling tired, so having generally low energy levels can be a sign of lung cancer. Also unexplained weight loss. But don't get me wrong, what you don't want to do is Google your signs and symptoms and then start self-diagnosing. That is the worst thing you can do, because we start to create what we call the worried well. So we want to make sure that if you do have any signs and symptoms, just go get them checked out. Don't use, WebMD and self-diagnose. Not a good start. We've then got prostate cancer. This is one of the ones that we really need to highlight because the risks are a little bit higher than testicular cancer, but it's also quite difficult from a screening point of view. So does anybody know what age you would get a prostate exam?
40?
Nope.
50.
It's going to be 50 years old. Now, even at 50, it's a lot of GPs, what they will do is they will look at certain other health metrics to see how at risk somebody is before determining whether they need a prostate exam. Now, I want to tell you about a guy called Lloyd. So one of my colleagues that works for, so we're part of a company called the Romero Group. It's an insurance business. And Lloyd was one of the directors. Now, Lloyd, at 42, he started displaying some of the signs and symptoms, or probably about 40, he started displaying some of the signs and symptoms, which would turn out to be prostate cancer. So he had blood in his urine, he had like a bit of fatigue, he was trouble going to the bathroom, and he didn't do anything about it because he's a bloke. He ignored it for a while, and then it got to a point where he got nudged by his boss to go for a medical, and at age 42, Lloyd was diagnosed with stage 4 prostate cancer. And it had got to the point where it was too late. So at 42, with a stage 4 prostate cancer, I think you've got about a 30% chance of living for 5 years. Now, Lloyd was one of my colleagues and he died last year. And Lloyd had 2 little girls, same age as my little girls. And the frustration we've got is that Lloyd died of prostate cancer earlier than the age he would even be allowed to go for any kind of routine screening. So if there's one thing I would encourage you to do is if you're over 40, if you're 40 or above, even if you self-fund it, go for a prostate check. So when this all kicked off, I was early 30s. I was about 32, 33. So I went and paid for a Bupa medical and just went and got it checked. It's not the highlight. It wasn't the highlight of my week, going and getting a prostate check, but the peace of mind, it might cost me 100 quid or 200 quid or whatever it costs, but the peace of mind of going and having it was worth every penny. So if I could give you any recommendation, that would be it. So what can sometimes happen is at 40, has anybody been for an NHS Wellman check? So when you hit 40, you should, and this depends on your NHS trust of how stretched they are, but at 40, you should get offered a Wellman check. So a Wellman check is it'll be height, weight, it would really baseline measurements. So it'll be height, weight, body composition, testicular examination, and what we call a Wellman blood test. So it would be something called a hematology profile, a biochemistry profile, which is like liver function, kidney function, your cholesterol profile, but also then a PSA. And a PSA is a prostate-specific antigen test. So when someone's got an enlarged prostate, obviously everything that happens in the body releases a reaction or a trace within the blood, and the PSA would be that trace. It's not the overall test that you should have. It's not the be all and end all, but it's a good inclination to start with. So I would be recommending, if you are over 40, the least you should be doing is going and getting a PSA. If not, both, just for good peace of mind. So I'm 36 now, and I'll be going again next year for all of it, just to check. Any questions about that? Okay, if anybody does, I'll give you all my email address afterwards. If anybody wants any recommendations or suggestions or any personal questions, give us a shout. I've had it all. Yeah. So happy to talk about it. So main cause of prostate cancer then. So increased risk with age, significantly in men over 50. Those for African descent are at higher risk, and those with first family members. So if you've got a first family member who's had prostate cancer, you are more likely to experience it yourself. So these are all things. So if you're unaware of your family history, have a chat. Have a chat with your family members, have a chat with your parents, have a chat with your siblings to see what health concerns they have. A lot of the time, these things get kept to themselves. I was talking to my mum recently, and she was telling me that she had a breast cancer, not just a scare, but she had early onset breast cancer like 20 years ago, didn't even know about it. Because people keep stuff to themselves because they think it's private. But when it comes to family health, it's worth just asking that question, because obviously you need to lower your risk as well, hereditary factors. So some of the symptoms there, so needing to pee more frequently, urgency, hesitancy. So if you're struggling to go, we'll sometimes refer to it as stage fright, weak flow or blood in the urine or blood in the semen as well. So these are all things that we want to be checking or being aware of. But definitely prostate exam. So it's the finger, also a PSA blood test that you can get done. So then we've got testicular cancer. So when we talk about testicular cancer, it's actually a relatively low risk. Does anybody know what age range is of the higher risk of testicular cancer? Do you get more at risk as you get older or while you're younger?
Older, I think, like 60 maybe.
Nope. It's actually younger. So it's most common in men 15 to 49. So this is a higher risk while you are younger. So this is what's sometimes referred to as a young man's cancer. It's relatively low risk. One of the things that we need to be making sure we're doing is checking. So I did a recent poll in the lead up to Men's Health Awareness. I did a bit of a poll on LinkedIn to see how often blokes were checking the nuts. And the majority of people, so I think I had 4 different levels. So I don't check it at all. I don't check it enough. I check it fairly frequently, or I should probably put them down. it might become a problem. And most people said that they don't check it enough. So this is something that, you know, I did a little talk on this this last week, but generally we want to be checking this. It's an easy one to check on a weekly basis. We know what happens down there when it's cold outside, so don't check when it's cold. Make sure that you're nice and warm. So whether you're in bed, you're under the duvet, you're in the shower, and your body temperature is warm, you basically just hold onto your testicles and roll through your thumb. So a little bit like women would do with checking breast cancer. I'm going to pretend that I've got some breasts to show you, but basically like what women would do is using the palm of their hand to flatten through the breast to push through. You're basically looking for like inconsistencies in the surface. So trying to like roll your thumb over the skin to make sure there's no small bumps. A lot of guys will have cysts. So some of you may have a cyst. Obviously, if you do have a cyst, that will appear like a small lump on a testicle or coming off a testicle. All that needs to happen there is you go to your GP and they will do an ultrasound. So put some of that cold jelly like they do when a woman's pregnant, and do an ultrasound onto the testicle just to see what it's made up of. And more often than not, it would be a cyst that's of no concern. But really what you're looking for is change. So a little bit like when we talk about mental health, we're looking for changes. So if you need to be checking regularly to notice if there are any subtle changes. And if you do notice a subtle change, pop yourself to your GP for a quick check. Everybody happy with that? It's a really, really simple thing to do. All right. So what you should be noticing then, a pea-sized lump on one or both the testicles. Most lumps that are found are not cancerous, but should always be checked. Increasing in firmness. So things like a cyst might start off quite soft because it's generally mostly made up of fluid, but they can become harder over time, or aching or heaviness. So these are all things, but that can also be a sign of things like twisted testicle that can give that aching feeling. So there's lots of different things that can happen there, but generally making sure that you're looking out for any subtle changes. Can I move on from the penis screen? We all okay with that? Thank you. Right. I've always got to make sure I was doing these seminars, and one of the kids was off school last week, and I was just praying she didn't walk in whilst I was on the penis screen. I thought that would be a difficult one to talk about. Okay, so when we talk about suicide, this is obviously something that we talk about a lot in our mental health awareness sessions. It's something that we all need to become a bit more comfortable speaking about. I had to come to terms with talking about it more frequently because of the job that I do. But what I find is by speaking about it more, it helps me deal with it, as in the fact that I've got 3 friends that are not here anymore. And I do talk about it on a daily basis. And I feel, and that's a bit like therapy because I do speak about it, but it also gets people to open up. And I think one of the best things that you can do is if you've got an experience, if you've got a story, if you've got some sort of insight, get people talking about it. I always share this example when I talk about sort of men's health and mental health with regards to men. Is a couple of years ago, I was up in Darlington, up in the Northeast, doing a training course for some truck drivers, talking to these truck drivers about emotions. Now, can you imagine how hard that was? Talking to these Northeast burly blokes about their emotions. Not the easiest session in the world. But what happened was, as soon as I talked about an experience that I'd had myself, so I would classify myself as somebody who's had situational depression. I've been depressed because of a situation that I was in, not clinical depression, but because I basically had chronic back problems, and I got depressed with it because it was relentless. And I talked about it in front of these guys. Then one of them put his hand up and said, I've been through exactly the same thing. And before you knew it, these 6 guys, these 6 truck drivers were sat around the table talking about their mental health and their emotions. And it's just, for me, it just demonstrated the power of having a good conversation with somebody. So if you're not talking about mental health or well-being with your colleagues, you should be. If you're struggling and you're balling it up, you need to grab a brew and talk to somebody about it. That's one of the key things. you know, obviously being from Yorkshire tea, I'm a big fan of the power of the brew. Sitting down, having a cup of tea with somebody and just having an informal chat. That needs to happen more. Even if it's even if you're working from home and it's on Zoom, doesn't matter. Just booking a call, having a chat with somebody. You've got an amazing network of wellbeing champions that they've been trained to sit and have conversations with people. If you're not sure who they are, go and find out. And we'll be doing more work with the wellbeing champions. And the champions have all been.
Andy, if they don't know who they are, just a bit of promo. We did put them out on Brew Around today, the 19 wellbeing champions that we've got and their contact details.
Yeah, and it's not that they're not counsellors. They're not there to tell you what you need to be doing. But it's just about listening. It's just somebody, and those people have become champions because they genuinely care. And what's great is to have people within an organisation that really do care. And that's the intention of having a network of wellbeing champions. So to use them, even if you just want to chat, even if you don't think you've got mental ill health, you're just having a crap day, give them a shout. Okay. So may cause the suicide. It's impossible to pinpoint, but contributing factors can be lack of communication, financial pressures, relationship breakdowns, what we were talking about earlier, not being able to see kids on their own terms, mental ill health, obviously a big concern, financial constraints, lots and lots of different reasons. But generally not good conversations. We're not talking about it enough. It's bottling things up. So when we talk about some of the symptoms, it can be things or things that we might identify. A big one here is negative self-talk, people putting themselves down. Feeling like a burden, saying that I'm not good enough, or people and so-and-so would be better off without me, etc. People feeling like they've got a lack of purpose. We all complain about, we've all had a moan about work before, but coming to work and having a job gives us purpose in life. So one of the things we often see in people who are long-term unemployed or redundant, that can be a sudden lack of purpose, can have that. Lack of enjoyment. So one of the things that I noticed when I went through this period, this sort of like a 4-month period of situational depression, was I lost the joy in life. The things that I normally love doing, taking my wife out on date nights, going out with the guys, playing with the kids, going to the gym, I just lost the enjoyment for it. So if somebody's not doing the things that they would normally love, or they've lost the joy in it, or if you've lost the joy in the things that you normally would like, that you enjoy doing, pay attention to it. Yeah. And if you need to have a conversation with somebody, there's a load of people there for you to speak to. Okay. Negative coping strategies is another one. So we know that we all cope with stress in different ways. I'm a self-confessed emotional eater. So I'm normally found with a massive block of chocolate after a rubbish day at work. But some people, it might be drugs, some might be alcohol, some might be aggression. So just pay attention to your coping strategies and the coping strategies of those that you work with as well and live with. Okay, so when we talk about your health and well-being, has anybody got any specific questions for me about screening or other areas of men's health? Putting you on the spot. Don't worry if you don't. Okay, I will take that silence and I will move on. So when we look at managing the risks, like I said before, I am a big advocate of manageable health, the things that you've got some control over, accountability, personal well-being, self-care, whatever you want to call it. So first of all, things like drinking plenty of water seems like a simple thing, but provides us with a lot of useful things. If we solely focus on just drinking more water to start with, we'll improve our energy levels, we'll improve our sleep, we'll improve the way that we feel, our personal psychology, all of these things related to being adequately hydrated. So a really, really simple thing we can make sure we're doing. One is maintaining a healthy weight. So looking at your body mass index, obviously if someone's got a higher body mass index and a high waist to hip ratio, or they've got a high level of body fat, that's going to increase potential blood pressure. It's also going to increase heart rate and pressure on joints and everything else. So trying to maintain a healthy weight where possible. We've then got looking at medical or going for a regular checkup. So on the NHS, you would be provided with, or you should be provided with a Wellman check at 40. A lot of GPs, I think a lot of them have stopped promoting it just because they're a bit overwhelmed with everything else that's going on in public health at the minute. But going for a regular checkup should be something that's on your radar. And there's really simple things that we can be doing. We should also be looking at our nutrition. Obviously, if we are what we eat, if we're not eating a healthy, well-balanced diet, then that's going to contribute to things like weight gain, high blood pressure, and everything else. Hygiene goes without saying. You can also add in sort of self-assessment into this, and then keeping active. Now, as an example, especially when we think about heart disease, one of the things that happens is when we exercise, we get an increase in heart rate and blood pressure. So obviously that at the time that we're exercising, our blood pressure and our heart rate are increased. So you might think that that's a bit of a disadvantage to somebody that's got high blood pressure. So if someone's got extremely high blood pressure, we wouldn't recommend they go and exercise because that can put additional pressure on the heart. But for general high blood pressure, what happens is when we exercise, our body temperature increases. And when the body temperature increases, it dilates blood vessels. So the blood vessels expand, and that increases blood flow, which reduces blood pressure. And blood pressure can stay down for up to about 10 milliliters per measurement for up to about 10 hours. So if you're not exercising on a daily basis, and when I talk about exercise, I mean just like a brisk walk, something to get you a little bit out of breath and your body temperature raised, that's more than enough. Okay, so just those simple things. The other thing that we can contribute to all of this as well is good quality sleep. When we talk about mental health or mental ill health in particular, poor sleep has been associated with every single mental ill health condition there is. So if you're not investing in good quality sleep, you're massively missing a trick. Now, I know there's a lot of things there that you could think about, right, I need to change this, I need to change this, I need to change this. What I would recommend is just focus on one simple thing. So one of the things that we do at We Are Wellbeing is we use something called the 8x6 principle. The 8x6 principle is the concept that we have 8 blocks of 6 weeks in every calendar year. So instead of trying to change everything at once, pick one simple thing and try and change it in that 6-week period. So the first thing might be, I'm just going to drink more water for 6 weeks, and then focus on the next, and then it becomes a habit. And then the next thing might be, I'm going to try and do a bit more walking, etc. And you just build up and build up. So this is what we call marginal gains theory. So baby steps in the right direction. So in summary, ischemic heart disease or coronary heart disease or cardiovascular disease, lots of different terms that we can use, is the primary cause of death in guys. Prostate cancer is definitely something that we need to be getting checked. In terms of, you're not going to get a prostate check before 50, but you can, like I do, I just bite the bullet and I pay for it just for the peace of mind. It's definitely worth it, based on the fact that I know a couple of people who aren't here anymore who were under 50 who wouldn't have got the check. Testicular cancer, start off with self-assessment. Should be checking on a weekly basis. Make sure you check when you're in the shower, when you're nice and warm, and just check for inconsistencies or changes that might occur. Look after your mental health. The best thing that you can do there is speaking to each other. Speak to your wellbeing champions as well. Utilize those positive actions. So get the basics right. Forget complex diets, forget complex exercise regimes, lifestyle change, overhauling, all that kind of stuff. Just do the simple stuff. If you get the basic stuff right, you're going to be onto a winner. If you need any insight for that, just give us a shout. There's loads of resources we've got. We can, happy to chat to anybody. And then the final thing is make sure that you go for some sort of regular screening. Don't bury your head in the sand. Check yourself before you wreck yourself. Any questions? I'm a fan of dogs. Okay. Oh. Right. So if anybody does have any questions, there are a ton of resources on wearewellbeing.co.uk. My email address is andy wearewellbeing.co.uk. So if anybody wants to give us a shout, anybody got any questions, feel free to get in touch. Is that all right? Hopefully that's been some use to you all. I'm just going to stop my screen there. There's obviously lots and lots of different other subjects that we can be talking about. And what we try and do is we try and constantly develop the content and the resources that we have. So if anybody does have anything, feel free to just give us a shout. Is that all right? Brilliant. Right. Well, I'm going to leave you all to your afternoon. Have a good one. And if there is anything, you know where I am.
Thanks so much, Andy.
Thank you, Andy.
Cheers, everybody. Take care.
Bye.
Cheers.